Welcome to the Scottsdale Vibes Podcast. I'm Alicia Haygood. We are going to introduce you today to an amazing, incredible doctor, Dr. Ashu Goyle with Integrative Spine, Pain, and Wellness. He is going to talk to you about why you are more than just a patient when you come into his office. You are a person, and that's really what makes him stand out with his holistic approach to pain management and whole health wellness. So let's take a short break. When we come back, we're going to have Dr. Goyle at the table with me.
Buying a home can be scary and sometimes frustrating, but all of that can go away with the right realtor. And that's where Shawn Shackleton with the Shackleton Group is here for you. Shawn has over 25 years experience in real estate. She's here to get you what you want and won't settle for less. She's experienced, knowledgeable, and understands this market, which these days is always changing. Take the stress out of your next home purchase by calling Shawn at 480-734-7277. You can also find her at theshackletongroup.com.
A double board certified doctor, Dr. Goyle is all about holistic whole health when it comes to his patients and his treatment plans. Dr. Goyle is the owner of Integrative Spine, Pain, and Wellness in North Scottsdale. His purpose and passion is all about you. You're more than a patient. As I said earlier, you are a person when you come into the office, and this is what makes him so unique. It is a family business. Him and his wife do everything. They have incredible nurses and more. So I'm so excited to introduce to you Dr. Goyle. Thank you. We made this happen. I know you're so busy with everything, so thank you for taking the time with me. But I really want to start very simple at the beginning and just why. Like, why did you get into medicine and why pain management so specifically?
Great, Alicia. Thanks so much for having me here. That's kind of a long story, so I'll do my best to kind of...
We're here for it.
Okay, shorten it a bit. But I grew up in a small town in southeastern Ohio.
Okay.
My parents were from India. They immigrated here in the early 70s, as many Indians did at the time. They chose to settle in Marietta, Ohio. It's a small town right on the border of Ohio and West Virginia. It's a beautiful part of the country. It's about as salt of the earth as you can get.
Oh.
So I grew up there. My first passion was music. So I discovered guitar at a very young age, began going to concerts, playing music, learning to write songs, playing in bands. And so that was kind of where my heart and soul was, right?
Okay.
I got to college. I was very undecided, and I was following bands around. I'm really into the Grateful Dead. So
okay. Have you seen him at the Sphere? Really?
I saw 7 shows there.
I bet you did.
Yeah.
To change the subject really quick.
For sure. Yeah, they're still a deep part of who I am and have influenced me quite extensively. So.
Yeah.
But I was going to a lot of concerts. I was in college trying to figure out what I wanted to do when I grew up, right? And so I had a summer between my freshman year and sophomore years of college. And my parents were like, hey, why don't you volunteer at our local hospital? I'm like, all right, I got nothing else to do. I was working a part-time job at the time. So I volunteered at our local hospital. And the director of the volunteer services noticed I played guitar. He's like, hey, would you mind coming in on Sundays and playing guitar for our inpatient psychiatric patients?
Aww.
I said, is that a thing? Like, yeah, I'll totally do that. And that's volunteering. I'm like, man, mom and dad are going to have no idea I'm going to go volunteer at the hospital with my guitar.
To go play music.
Exactly. So I did that. And it was profoundly enlightening for me, just the joy that people would get out of hearing the music. They'd request songs. I'd go learn them, bring back songs, and really connect with people. Right, on a deep level. I feel like music can do that, and that's why it's really influenced me. But here's what happened. On the way out one day, I was carrying my guitar, and this guy behind me said, hey, what kind of guitar you got there? I said, oh, it's a Seagull. He's like, oh, yeah, those are handmade from Canada. He's like, do you mind if I play it? I'm like, okay, sure. Opened it up. He grabbed it and started jamming on it. He's like, this is a really nice guitar. He's like, what are you doing here? I'm like, oh, I'm volunteering. I play in the psychiatric ward on Sundays. He's like, well, I'm the ER director. So he's like, if you'd like, why don't you come volunteer in the emergency room? I was like, wow, a doctor who plays guitar? Like in my world at that time, I didn't know the two could be blended together.
Yeah.
I didn't think it was actually a thing. So I said, yeah, I'll do that. So I started shadowing him in the ER on Fridays.
Ooh.
Crazy overnight shift.
Yeah.
And I saw so much come through there, and it really sparked my interest in medicine. Like, maybe I can have music and medicine. So I started taking pre-med classes in college. And loved biology, loved chemistry, loved the sciences, physics. And at the same time, I was doing biomedical research, which happened to be in the nervous system, which is a big part of what I do now in pain management. And I just fell in love with medicine.
That's crazy.
Like, I want to be a doctor now. I mean, be a doctor who plays guitar.
Most people know that early on you start school for pre-med. You were like going into your sophomore year when you decided to do that.
Exactly.
Wow.
Yeah. And so then I went hardcore into pre-med and then got into medical school. During medical school, I went through all my rotations and started crossing things off the list. I thought I wanted to be a family doctor, but it didn't really resonate with me. So I crossed that off the list. Thought I wanted to be an ER doc from my experience earlier. Crossed that off the list. I'm like, I really don't like this job. And went through all these different specialties of medicine. And then I finally found anesthesia. And I liked the science behind what they do, the pharmacology, the physiology, basically being internal medicine specialist and critical care specialist in the operating room. Really, it's a lot of hands-on work that we get to do while we're there, intubating, starting IV lines, doing procedures, and I just fell in love with it. So I did an anesthesia rotation, and then one of the anesthesia docs I worked with was also a pain physician.
Okay.
And he said, "Hey, you should come shadow me in my pain clinic one week." And so I decided to do that because I had no idea what a pain clinic was.
Yeah.
So here's where everything really, really changed for me. So I shadowed him 1 week. He taught me how to do epidural injections, which are shots that we do into the spine to treat sciatic pain.
Okay.
And he showed me how to do these. Back then, we were doing these blind, which means that we go by feel rather than using X-ray. That's an anesthesia technique.
Okay.
It's very common in the late 90s to do it that way. And
he just looked at my face, and that's why he explained it. Because I was like, what?
Right. You're like, what's that?
Yeah.
Well, it's kind of similar to when we do epidurals for women who are pregnant.
Right. Well, I had two of those.
It's all by feel, right? So we learn how to feel the different tissues and get into the epidural space. So he taught me that in my third year of medical school.
Okay.
And I fell in love with the procedures. He also happened to be really into music. So here's another physician really into music who was using his hands to make a difference in people's lives. But the kicker was, after we did the procedures on one morning, I walked around. I saw a lady who was sitting in her bed with a big smile on her face. Her husband was sitting next to her, and he had tears in his eyes. I said, "Sir, everything went well. She did great. Is everything okay?" He's like, "I haven't seen her smile for 3 months."
Oh, my
He's
gosh.
like, "She's been in so much pain." He's like, "This is the first smile she's had on her face in 3 months." I was like, sold. I want to do this job.
Oh, I got teary. I don't even know them.
Yeah. I was like, so how do I do this?
Yeah.
And I was rotating through the Cleveland Clinic at the time because I'm from Ohio. I did all my medical training there. And I talked to the program director. He said, "Hey, we have the best program in the country." I'm like, "Well, how do I get this? How do I get a spot here as a fellow?"
Yeah.
He's like, "Well, get into anesthesia residency here, do well, and then maybe we'll give you a shot at the pain fellowship." So that was my path. So
That's
I got into the
crazy.
anesthesia residency program at Cleveland Clinic, did my pain fellowship there, and then started on my journey into what I'm doing now.
Do your parents have any medical background, like in their profession?
They don't.
Yeah.
My dad's an engineer, and my mother was a teacher in India just for a couple of years before she got married. And then she was a homemaker, housewife, and raised my sister and I.
Because it's, so many, you kind of follow somewhat in your family's footsteps of career sometimes and stuff like that. So I was interested, like, how you got in. That's amazing.
Well, they wanted me to be an engineer.
Okay.
My dad was an engineer.
Yeah.
I tried that for a summer, and I just did not connect at all.
Listen, I'm married into an engineer family. They're a breed. They're
for
their own
sure.
breed.
Exactly.
And it's a little drier personality kind of thing.
It
So
is,
yeah,
for
you're too
sure.
vibrant for that. I understand.
Yeah, and I'm a people person.
Yeah,
so I
exactly.
really need to connect with people. So although I loved anesthesia, all my patients were asleep. Right. So I couldn't wait to get into the pain management realm where I could actually sit down and connect with people, get to know them. And my whole philosophy is developing lifelong relationships with people.
Yeah.
And pain management allows me to do that. Right. So after a year of private practice in Columbus, I came to sunny Arizona in 2008. Been here for a little over 16 years now. I was with a big anesthesia and pain group for until 2021.
Oh.
And then I decided to start my own practice, integrated spine pain and wellness, in June of 2021, with a focus and emphasis on holistic pain management. So in Scottsdale, we are surrounded by amazing physicians.
Yeah.
I mean, we got Barrow Neurological Institute. We're one of the top neurological institutes in the country. We have Phoenix Children's. We have amazing pain physicians, internal medicine doctors, surgeons. We're in a very medically rich community. Mm-hmm. So I wanted to set myself apart from other pain specialists in the area by focusing on holistic pain management.
Let's talk about that specifically a little bit, because I want to talk about pain, the word pain. It comes in many different forms.
Sure.
There is temporary, there is long-term. Like you talked about that patient where she hadn't smiled in 3 years because it's just constant.
Right.
What what is pain? And I know there's anything and everything can cause it, but start with the basic forms of why someone might come to see you for pain management.
Yeah, and so there are many reasons, but the most common thing I see is back pain.
Okay.
So, and this can be chronic back pain, meaning they've had pain for years, or it can be acute back pain, which means that they were playing golf and all of a sudden their back went out and now they've got back pain and shooting pain down their leg.
Okay.
Right. So that's usually what gets them to the door. They've got a situation where they're having an unpleasant physical sensation in their body that's limiting them from doing the things that they love to do.
Okay.
Right. And so whatever that is, that could be going to work, it could be playing with their grandkids, it could be inability to golf, play pickleball, anything.
I would die. I love my pickleball.
Most people do, yeah. And so I'm seeing a lot of pickleball injuries now. So
great.
Just be careful. But that's what
I'm not that good. We're okay.
But that's what gets them through the door.
Okay.
Some complaint of pain. It can be joint pain, knee pain, back pain, neck pain. Something physical is happening to their body that's unpleasant, that's distracting them from who they are.
So someone walks into the office, you distinguish, they talk to you about where the pain is, what might have triggered it or something like that. Holistic approach. What does that mean for you and your practice and how you treat your patients?
Well, we try to look at the root cause. I mean, that's my goal in every single person.
Love that.
And I spend time with people. I think that's where you find the real answers, right? So my visits tend to be longer. My practice is a hybrid between cash and insurance. And so that affords me more time to spend with patients.
I love that.
I feel like the more time you spend with people, the deeper you can connect. And then you start to learn where this is really coming from, right? Sure, they have a herniated disc, it's slipped, it's hitting a nerve, but what caused that? Oh, it's golf, but what caused why did playing golf cause this? Because not all golfers have this injury, right?
Fair.
What happened to you? And it could be something as simple as lack of core musculature. They're not stretching beforehand. Their diet's poor. They're just not conditioned to do the things that they love, right? And they're going out there and they're doing these things and they're injuring themselves.
Yeah.
So that's the holistic approach, is really getting to the root cause, which can be diet. It can be lack of sleep. It can be, I always say win with nutrition. Nutrition is the foundation, right? Food is medicine. And then physical therapy and movement. So people may not be moving their bodies right.
Yeah.
They want to go play golf, have a good time with their buddies. And in the process, they're doing these moves that their body's not accustomed to. And over time, repeated rotation and motion will cause injury.
Okay. I mean, you think about Tiger Woods. I mean, many professional golfers have had that because it's the same movement over and over and over. It kind of just wears it down, I would assume.
It does, absolutely. Yeah, I take care of a lot of golf pros, especially being in Scottsdale.
Yeah.
Some have started playing golf when they were 3.
Yeah.
And in their 20s, their L4-5, which is the lower back area, is completely shot, degenerated.
Already in your 20s.
Already in their 20s from poor form for 20 years. Right? So this can start at a very young age, and then it's just a repetitive motion. But it's getting to the root cause. Like, where did this come from? Oh, it came from your poor form. Like, that's what we need to work on. So I'm a big fan of physical therapy and connecting with physical therapists who really care. I'm all about personalized medicine. It's not one size fits all, right?
Yeah.
So if you came to my office and I were to see you for, like a pickleball injury or something, we'd look and really examine your biomechanics, and I'd find a physical therapist who I think you would resonate with to really work with you to correct whatever deficits you may have or whatever truly caused the injury.
So that's what makes you stand out, is like, you're going to send them to the place that can fix them, right? You're not just taking a person in just to take on a new patient or something like that. That's not what you're about, fixing the actual issue, that holistic approach.
Exactly.
When we think of pain management, I know so many people do. We think about just getting shots, pills, whatever you need, the Band-Aid quick fix, that it's not you. So talk about the mind shift of really having to pull away from these pain management pills that really are just a Band-Aid for some of it, and convincing people of like, that's not what's going to fix the problem. What are some treatment plans that you work on? Because you are very new age, high tech, which I'm so excited about, of how to really fix your problem without just popping pills every single day for it.
That's a fantastic question. Now, I'm not anti-pills, I'm not anti-shots, because I believe we need to have a wide variety of tools.
I totally
in our
agree,
arsenal
yes.
to truly help people. And in my last practice, medication management was a big part of the practice, and it did help people. Mm-hmm. And then so did injections. I did a lot of injections in my last practice. But now, like, having moved into my own practice, I get to do things the way I truly resonate with. Like, what would I want? And I've actually had some pain issues pop up into my life intermittently. And for me, I like a more natural and holistic approach.
Yeah.
Like, let's really get to the root cause. Let's focus on diet. Let's focus on nutrition. And I'm still doing procedures. When people come to me who are on pain medication, I have a conversation with them. I'm like, what if we tried coming off of these medications? I don't prescribe pain medications in my practice. I'll focus more on supplements and diet and lifestyle changes because that's getting to the root cause. Right?
Yeah.
There's a time where you need to mask pain, and I completely understand that, and I support that. Just my practice is a little bit different than that. But it's really talking to people and learning why they're on their medications. A lot of times I'll see people who've been on narcotics for years.
Yeah.
And we talk about weaning off. I'm like, well, go back to your pain management specialist who's prescribing these. See if you can come up with a plan to wean off of these over the next 3 to 6 months and then come back to see me.
Okay.
And many people do that and their pain hasn't changed at all. And they realize that these pills were not working.
Yeah.
You get
That's
to a
scary.
certain point where the receptors are blocked.
Yeah.
And then you just become physically dependent upon these pills because you need endorphins to survive. And these pills mimic those endorphins and shut your body's natural ability to produce them off. So then you need the pill just to function day to day.
That's terrible.
Yeah. It can be scary because it can take over people's lives. And, now we know with the opioid epidemic, the fentanyl epidemic, people are overdosing and dying. So it's good to have these alternatives available to us. And one thing I like to focus on in my practice is using the body's own natural healing ability. Right. So
it's a pretty powerful thing.
Yeah. So there's this field of biology there's this field of medicine that's emerging called orthobiologics. And this is where we use the body's own healing ability, either blood platelets, stem cells from bone marrow or adipose. We concentrate growth factors and anti-inflammatory proteins in cells, and we can inject those into different parts of the body and actually repair tissue. And that's truly what my passion is these days. Yeah, is really getting to the root cause. Like I see someone with a spine issue, like a herniated disc. We have evidence that shows that when these growth factors are injected around the disc, they'll cause resorption of that disc herniation. So what that means is where the disc is slipped out of place, these platelets over the next 6 to 12 weeks will actually allow that disc to slip back into place.
Really?
It's phenomenal. Yeah. And this is our own body's way to heal itself. We just magnify that. And deliver it precisely. It's all precision guided with x-rays, with ultrasound, and we deliver these platelets, these stem cells to these areas, and we can actually promote healing.
That's crazy. My mom has degenerative disc, so I want to call her and tell her this.
Yeah.
She doesn't really do much. She tries to do yoga and stuff like that, better stretching and stuff. But like she said, this is decades of not doing the right thing for so long and just helping what I can do now kind of thing.
Right.
I think it's amazing what our bodies can do. And I'm so happy that doctors like you are coming back around to, wait a second, we can do this on our own and not just keep Band-Aiding everything
And that's
for it.
Traditional pain management is putting a Band-Aid on everything.
Right.
We do epidural steroid injections or cortisone shots.
Yeah.
Cortisone is great for relieving inflammation, but there are potential side effects that come along with that. It can affect your blood glucose levels, your sugar levels. It can increase risk of infection. It can thin your bones. It can affect your whole entire hormonal system.
So now you're going to be on more medicine down the road to fix those problems.
Possibly, yeah. It also breaks down tissue. So we know from several studies, if you put steroids inside a hip, it can lead to what's called rapidly destructive hip disease within a few months, which means the cartilage breaks down pretty fast, yeah. And so the same thing can happen in other parts of our body as well. So I like to shy people away from those if they can. Like steroids are good for acute pain relief. Like if you're miserable, you have severe pain that's limiting your ability to function or enjoy life, well, there's a place for those, right? But traditionally in pain management, we just repeat those over and over and over again. We do these ablative procedures where we can use heat to cauterize tiny nerves in our body that basically shut off pain signals, but they come with side effects as well. And a lot of times they'll cause muscle atrophy. And your muscles will degenerate over time, which leads to instability, which leads to a spine fusion, which doesn't work because it wasn't the degenerative discs that were the issue. It was the lack of the core strength. So
I'm like I'm just like staring at you.
It turns into a vicious cycle. But that's where the orthobiologic field comes into play, because now we can use the body's own natural healing ability to repair the joints, to repair the ligaments, to repair the muscle injuries.
That's crazy. Talk about lasers, because I've had some laser therapy done on a injury from like 5 years ago on my shoulder. I did physical therapy twice, stretching and all that, went and did laser therapy, and now I feel better for the first time in like 5 years.
Yeah, there's some real promise with laser therapy. So in the realm of pain management and sports medicine, these lasers have been around for about 30 years in Europe. They were pretty popular in the sports world, and they've trickled down to everyday use. About 12 to 14 years ago, the lasers started showing up in the U.S. And initially they were in the NFL, the MLB, and the NBA.
Okay.
Then those sports medicine docs started sharing the utility of these lasers with the general community, and now they're pretty common. And I think any more advanced holistic pain practitioner is going to have a laser in their arsenal. And so these lasers work by using what's called photobiomodulation, which is light therapy.
Okay.
So light has wave-like properties and particle-like properties. It penetrates deep into the cells, and it stimulates a part of our cell called the mitochondria. So the mitochondria get activated, produce what's called ATP, and this can initiate a whole anti-inflammatory cascade and repair tissues. So what they found, this is pretty fascinating. So we use this laser therapy for osteoarthritis or inflammation of joints, so arthritic pain. We can also use it for neuropathy, which is like a burning pain condition that happens when your nerves aren't firing normally. The laser can actually correct some of the dysfunction on the outside of the nerve called the myelin sheath. So sometimes that gets disrupted, and that's a cause of the pain. And the laser can actually help those tissues heal. What they found, at least in Europe, and we're seeing that here now too, is that if you're treating a foot that has neuropathy, and let's say it's a diabetic patient, and they have an ulcer on their foot. So diabetics will commonly get ulcers on their feet, and these are wounds that won't heal. The laser will actually not only help the neuropathy, but it can actually help heal the wound. So the laser we have in our clinic is actually going through FDA clearance for FDA approval for wound healing.
Wow.
Yeah, so it stimulates healing. So that's, in a nutshell, what the lasers do.
That's just crazy to me. Yeah. Do you think that Europe is kind of ahead of the U.S. on some of the ways we do treatment plans? I know that's a big thing with like the pushing of the food and what we put in our bodies here in the United States and kind of stuff like that.
Yeah, absolutely. Yeah, I mean, we follow Food Babe quite a bit. I don't know if you're familiar.
Yeah.
She's pretty extraordinary.
She's great.
Doing amazing work. But the foods in Europe have different ingredients in the same foods in the U.S.
It's crazy.
Right? It is, yeah. So a lot of these chemicals have been banned. Same thing with medicine. In Europe, they're way ahead of us in terms of stem cells.
Yeah, that's what I'm wondering.
Yeah. So there's something called culture-expanded stem cells, and I really believe that's going to be the future of medicine, where we can take stem cells from an individual, send them to a very, very highly specialized cell biology lab. The cells are grown basically in a dish from a few 100,000 to billions. And these are your own stem cells. And then over the course of the next few years, they can be saved and cryopreserved and then re-injected into different parts of your body to help tissues heal. So they're doing that in Europe now. They're doing that in the Middle East. Dubai right now has there's a Dr. Akon is there, and he's doing tremendous work in the stem cell world. But the U.S., we can't do any of that unless it's part of a research study. So the FDA has a tight control of that right now.
Yeah.
Will that change? I don't know. I hope so. There are a lot of people doing research and trying to bring this modality to mainstream because it can revolutionize medicine. May put big pharma out of business, so that may be
that's a different topic for a different day.
Exactly, that we have to grapple with. But yeah, Europe is way ahead of us on many frontiers
on that aspect. Mm-hmm. You've mentioned this a few times, so let's just kind of dive into it. Preventative ways. Obviously, we all know diet and exercise, first and foremost, the most important thing. What are other things that we can do now, or even, I'm in my 40s, so I can't go back in time and change anything. What can I start now at this age of my life?
Yeah, like you said, diet and nutrition, I think, is the foundation.
Yeah.
Exercise, but exercising appropriately, right? So sometimes you got to work out with a trainer, like learn body mechanics, learn proper form. This is where my physical therapy team comes into play. Like I see young, healthy people all the time who just want to be healthier. Mm-hmm. They're like, hey, look, I'm in my mid-20s or my mid-30s. In 20 years, I don't want to have degenerative changes. I don't want to have these issues, right? So what can I do now? I usually hook them up with a really highly skilled, individualized physical therapist who'll start working with their biomechanics.
Okay.
Right, to see what they're doing incorrectly and correct those things now. Because so I'll give you an example for myself. I started lifting weights and working out when I was 13. I used to wrestle, and then
I can so see that with you,
Oh
actually.
yeah, it was a good sport for me.
Yeah.
Yeah, I was a grappler, and I was a little guy, but I built some armor around
Yeah.
me, and I really developed a passion for exercise and lifting weights, and I've done that most of my life. But in 2008, I started having left knee pain, right? And then over time, like I had to give up racquetball, which was really, truly my favorite sport I've ever played. Had to give that up because of my knee. And then it wasn't until about 2017 that I had a really good physical therapist evaluate me and say, hey, look, you know what? When you work out, all your weight's on your left side. And to me, I felt completely balanced. When he balanced me, I felt like I was going to fall over to the right side. He's like, now you're balanced. So decades of working out, favoring one side, created dysfunction in my knee, most likely. So simple things like that. If you have someone who can evaluate you and give you those tools early on, you can change, right? And you can make things better. So that's a big part of it. So diet, exercise, we nailed those two. Other things that you can do. I'm a big fan of hyperbaric oxygen therapy. Okay. And this isn't for everyone. This involves going into a chamber. It can be a little claustrophobic. Yeah, it's 100% oxygen. It's under pressure. And this can have tissue regenerative benefits, right? So you can repair tissues. You can help heal wounds. It oxygenates tissues that normally don't have an adequate blood supply. So I'm a big fan of doing that. I also do photobiomodulation, where I go into a red light therapy bed.
Love that.
I do this once or twice a week, and it's full body red light therapy, right? And what this does is it, again, works on the mitochondrial level to stimulate healing of tissues, repair of tissues, reduces inflammation.
I love that. I love some red light therapy. It's been fun for me.
Sleep is incredibly important as well, right? So this is all foundational health. So diet, exercise, and sleep. So these are things that we can start at any time. Sleep hygiene is incredibly important. If you're having issues with sleep, then these are things I can help counsel on a bit. I'm not a sleep expert by any means, but I am connected to some extraordinary sleep medicine specialists. I'm a big fan of meditation too. So I've been meditating for several years. Really got deep over the last year with Dr. Joe Dispenza. I don't know if you're familiar with him.
Yeah, we've talked about him,
Yeah, he's pretty extraordinary. So I've really started getting deep into his meditations. But a lot of times I'll see patients and they don't even know where to begin with meditation.
Oh, yeah.
And so there are apps out there that are completely free that are guided.
Listen, I started meditating this year. That was my 2025 goal. And that was the first question. In fact, I even reached out to your wife. I was like, you meditate? Like, what do you do?
Yeah.
And this 10 minutes. Like, it's all I did. I started my day with 10 minutes, found an app that I love, and it has been a game changer for me. In fact, meditation has helped me when I wake up in the middle of the night, put me back to sleep, because I know how to calm my mind and my body down from meditating all year to go right back to sleep kind of thing. So it's been a game changer for me. And it really isn't more than like 10 to 15 minutes is what I start my morning with.
Exactly.
It's crazy.
Yeah.
Just the self-healing part of that.
Such a powerful tool, because we're always in that fight or flight state, right? That sympathetic overdrive. With meditation, once you connect with that, you slow your breathing down, right? You start to calm your brain down a little bit. And then you go back into that parasympathetic state, which is your restorative state. And that's where healing happens, right? And so you start your day off with that. It can just set the tone for the rest of the day.
Yeah. I'm just like, I'm just staring at you. I love your knowledge. Like I crave people that just are passionate about what they do, and that's how I learn from them. So,
well, all these things, like everything I do in my clinic, I've tried on myself.
Yeah, I love that.
Like before I started offering PRP to patients, I did it to myself, and I was like, wait, this actually worked. I was like, okay, cool. I got the data, but now I can see it firsthand that it actually made a difference. Like my last PRP treatment in my knee was a year and 7 months ago, and I'm 100% pain-free in my left knee.
That's crazy.
And I got an area where there's no cartilage, and it gave me grief for a long time, but the PRP worked phenomenally well. But that's something I did to myself before I offered it to other patients. Yeah.
It really is. The holistic is true and true for how you live and breathe and practice. I love that for you. So are you still playing for your patients now? Like, do you serenade them when they walk into the room? Little suck up,
Oh, man, I wish. Well, since starting this practice, it's been a labor of love.
Yes, it has.
So, like, honestly, if I pick up my guitar a couple of times a year, that's like a big win for me right now. So, yeah, I've turned into a guitar collector, which which my friends and I said that, listen, I know you love guitar, but always play them.
Yeah.
I'm like, I'm never going to stop playing. I'm not going to be a collector.
Oh, no.
Kind of turned into a collector.
We won't tell anybody. It'll be between just us.
It's all the viewers here, right? But yeah, I mean, I just don't have the time right now.
That's fair.
Or actually, I take that back. I'm not making the time.
I was about to say you're not creating up your time for you.
Exactly. That's a cop-out, what I just did there. So I have this conversation with patients, too. Like, it's all perspective, right? And Nikki, my wife, who's sitting right here, she calls me out on that all the time as well. It's an excuse, right? It's where I choose to spend my time and what I choose to focus my time on. And right now, I'm so critical of my guitar playing because at one time I was really, really amazing as a guitar player. I mean, I could think something in my head and it would come out.
Yeah.
Yeah. Like no limitations whatsoever. And because I'm not there, I'm very critical of my playing. And so I'm at the point now where I probably need to start practicing again. And I need to give myself time every day to do that. So
listen, I'm going to repeat what you just said. You're your own worst enemy, right?
Exactly,
you're your own worst critic. I guarantee you're going to play better than me because I can't play at all. So you already have someone you're better at than that.
Oh, right.
Good.
Yeah.
Where can we find you to learn more, to come visit you, and just understand even more of that personal connection you have with us as a community?
Yeah, great. So my practice is Integrated Spine, Pain, and Wellness. We're located at 7425 East Shea Boulevard, Suite 102 in Scottsdale, Arizona.
It's right there at Scottsdale and Shea.
Exactly, right at Scottsdale and Shea.
Yeah.
So we're on social media. My Instagram is probably my most popular account right now. It's Dr. Ashu, Ashu Goyle, Goyle. If you just do at Dr. Ashu Goyle, you'll find me on Instagram. Best way to get a hold of me, best way to connect with me. We post pretty regularly on there. A lot of patients have messaged me there. A lot of physicians who've wanted to learn more about what I do have messaged me there as well. We're on YouTube at the same Dr. Ashu Goyle as well. But and then our website.
Always.
ispwscottsdale.com.
And listen, we have all of this in the description of this episode and on the YouTube channel where the video episode of this as well. So if you didn't get a chance to write it down, don't worry. Just go to the description and click the link. It'll take you right there for everything. Dr. Goyle, I genuinely appreciate you because I appreciate you for what you're doing for our community and connecting everyone together. Because like you've said over and over, it's not just about you. We have amazing physicians and doctors and specialists in Scottsdale that you help as well, which really is just for your patients' purposes. And I love that. And focusing on whole health and holistic health and teaching our bodies to treat itself again. Like you said, you believe in medicine, but there's a way to avoid that as well. And let's try that way first.
Absolutely.
And I think it speaks volumes. Before we leave, my last question for every guest is, what's your favorite Scottsdale vibe?
Oh, wow.
It's so funny because I think it's an easy question, but everyone's like, this is kind of hard.
It is kind of hard. Man, I mean, really, so I'm very in tune with my environment.
Okay.
Right? And one of the reasons I came to Phoenix and Scottsdale was for sunshine.
Love it. Yeah, coming from Ohio, that's needed.
Absolutely. Yeah. My last year in Columbus, I didn't see the sun from November to April. And I was like, I can't do this the rest of my life. So I moved to the sunniest place I can. So the weather here, especially from October to May, is just phenomenal.
We hit it.
Yeah. And that's the vibe for me because it really allows you to live outside, be active, live a healthy lifestyle. I feel like in Scottsdale, there's a group of like-minded people who are here for that.
Yeah.
And I would say that's the vibe.
I love that. It's true, though, too. Well, thank you so much, seriously, for all you do. Again, check the description of this episode. We will have more of the links and everything else. And if you haven't watched this video, go to our YouTube channel and you can see Dr. Goyle yourself. Stay tuned. We'll be back with a calendar of events.
Thanks, Alicia.
When it comes to protecting you, your family, and all your assets, you need to have someone that you can trust. And that's Jeremy Mueller of State Farm Insurance. Jeremy Mueller has lived in Scottsdale his whole life. How can anyone else know your needs more than someone who's been here and seen it all? Jeremy and his team are always ranked in the top % at State Farm. He cares, he's knowledgeable, and most importantly, he's always available. Don't believe me? Give him a call at 480-515-5223 or find him at jeremymueller.com.
Get ready. It is Thanksgiving week, so I hope you've worn your sweatpants, got them out. You are ready for this. get a good walk in or something before that. We can make more room for all the delicious food you get to eat with friends and family this week. But guess what? There's still other fun things going on. The Kings Ranch $1 Million Breakaway Rodeo is happening this week, so get your tickets to the one and only all-women's breakaway rodeo at Westworld, November 27th through 30th. There's also a concert on Thursday through Saturday night after each day's final event, so lots of fun at Westworld. But with Thanksgiving always comes, the holidays have officially started. So let's get ready for Christmas and everything else that goes on in December. It is holiday time. It's officially starting with the Santa Social at Scottsdale Quarter. So bring the kids, have a great day. It's happening from 2 to 8 on Saturday, November 30th. Face painting, Santa will be there. It's the official tree lighting ceremony, and they're going to have a showing of Elf for you to watch. But when we happen to do this, it's one of my favorite monthly events. Scottsdale is happening in Old Town. So it's a whole month of events here in Old Town. So check out the site for all the events, from cooking classes, Santa appearances, toy drives, and more art walks and lots of fun things. Have a great week, Scottsdale. Happy Thanksgiving, and I'll see you around town.